Well, we focus a lot on COVID that's circulating right now. It's definitely an issue if it's been running through your office or your family and friends in the way that a lot of us have seen. But at the same time, there are so many other viruses that are swirling around right now. So we've got Dr. Scott Joy, who is the Chief Medical Officer with Health One. And Dr. Joy, we know that COVID cases have gone up, but what other viruses are you seeing right now that's pretty unusual for this time of year?
Well, I think one of the more unusual viruses we're starting to see is kind of a late surge in influenza. Usually we'll see that virus anytime between October and really the end of March. And we're starting to see a few cases trickle in and a few reports of patients testing positive for influenza. So that's something that we like to know about sooner than later. We do have some antivirals, some pills that people can take at early onset of influenza symptoms, but we do need to confirm that it's influenza, so testing is very important.
You know, how do our immune systems hold up to things like the flu or other respiratory viruses that are circulating right now because we've lived with these COVID protocols for so long?
Yeah, I think it's our immune systems are always getting a little bit of a workout. They're always seeing different viruses circulate throughout the year. So the immune system is being exposed to multiple viruses. Now, since we've been a little bit more cautious and thoughtful about our infection control procedures, we call them the 3 W's. We talk about washing your hands frequently, watching your distance, and wearing your mask. Our immune systems haven't been seeing these viruses as often as they had in the past. So it's kind of why there may be a little bit of delay. And I think one of the key things moving forward is maybe some things that were seasonal viruses in the past, like influenza or rhinoviruses, which are notoriously in the summer. With us changing our behavior, the seasonality of these viruses may go away. And that's why I think moving forward into the future, testing and knowing exactly what virus you have is going to be very important.
It's just flipped on so many things. I suspect this may have just happened in our house, but how often is it COVID plus something else that just leaves people feeling just like a disaster at home?
Yeah, it's a good question. I've not seen any data looking at people who are co-infected with a acute COVID infection or another common virus like the rhinovirus. So I think our epidemiologists and our researchers are going to be following this for years to come. We've had a big change in behavior, and I think it's going to change how we move forward. But I think the key is testing is important, and we do know how to prevent from getting sick from these viruses, and it's those 3 W's: washing your hands, wearing your mask, watching your distance, particularly as cases of COVID rise in the community.
Oh, well, you just answered my next question, which was the advice to folks. So you covered that already.
Well, there's one other advice I'd like to share if I could.
Yeah.
I think that getting your regular vaccines is very important because we talked about how the immune system needs to get a workout. And if your immune system isn't seeing the viruses, getting the vaccines that are recommended for you is a way to give your immune system a workout to kind of keep up with things and to kind of prevent not only the reason for the vaccine, but there's some interesting studies showing people who got regular influenza vaccines also had fewer other respiratory viruses throughout the year. So real good to talk to your primary care docs about getting your regular vaccines at a schedule.
All right. Well, thank you. That is fantastic perspective. We appreciate it, Dr. Joy.
Thank you.
All right. We'll be right back.